If you tried physical therapy, injections, even surgery, but your back pain keeps returning every few months, you're not alone. Most doctors will tell you it's degenerative disc disease or arthritis, and they'll show you the MRI to prove it. But here's what they're missing. 80% of chronic low back pain that keeps coming back has nothing to do with your spine. The real culprit is something you do every single day without thinking about it. I'm Dr. Jacob Kneeman, board-certified pain medicine physician, and today I'm revealing the 5 hidden reasons your back pain won't stay gone. And stick around until the end. I'll show you a simple 2-minute test you can do right now to figure out which one is causing your pain. If this helps you finally understand what's been going on, hit that like button and subscribe for more evidence-based pain education. Before we get into the list, let me tell you something that might surprise you. I perform spinal injections and procedures every single day in my practice. And you know what I've learned? The patients who get better results aren't always the ones with less severe findings on MRI. In fact, I've seen patients with terrible MRIs who have minimal pain. And on the other hand, I've seen patients with mild findings who are absolutely debilitated by their symptoms. This confused me early in my career until I started looking beyond the spine itself. This observation is backed by a landmark research publication in the American Journal of Neuroradiology in 2015, which actually showed that many people without any back pain at all have significant abnormalities on their MRIs, including, but not limited to, disc bulges, arthritis, and even disc herniations. The study actually found these abnormal findings in 30 to 80% of pain-free individuals, depending on age, of course. So today, we're going to talk about the 5 hidden reasons your low back pain keeps coming back. These are the things that most doctors don't have time to address in a 15-minute appointment. But understanding these could be the key to finally breaking that pain cycle. The first one is your hips. Here's the truth. Your hips and low back are biomechanically connected. When your hip muscles, especially your hip flexors and glutes, are weak or tight, your lower back has to compensate. Think of it like this. If one person on a team stops doing their job, everyone else has to work overtime. In my pain medicine practice, I consistently see this pattern. In fact, hip muscle dysfunction, particularly weak gluteal muscles and tight hip flexors, creates altered movement patterns that overload the lumbar spine. Here's exactly what happens. Tight hip flexors pull your pelvis forward, creating an excessive curve in your lower back. Weak glutes mean your back muscles have to overcompensate while stabilizing your entire body during the majority of your day, walking, standing, even while sitting. Over time, this creates a chronic overload situation. The telltale signs that this is your problem, for example, your back pain gets worse after sitting for about 30 or more minutes, you feel stiff when you first stand up, you have trouble putting on socks or shoes without back pain, and your pain is worse on one side compared to the other. The solution? Hip mobility work and gluteal muscle strengthening, not just low back exercises. If you've been doing back exercises for months with no improvement, consider having your physician or therapist evaluate your hips, for you might be missing something. Chronic stress is also rewiring your nervous system. Now, chronic stress doesn't just make you feel anxious. It literally changes how your nervous system processes pain signals. There's a phenomenon I find fascinating called central sensitization, and that's when your nervous system becomes hypersensitive and amplifies pain signals. It's literally like turning up the volume knob on your pain receptors to the max. Central sensitization is well established in pain medicine literature. When your nervous system is under chronic stress, it becomes hyper-vigilant and starts interpreting normal signals as threatening and scary. This isn't fake. It's a real, measurable change in how your brain and spinal cord process pain signals. When you're under chronic stress, whether it's work pressure, family issues, financial worry, it doesn't matter. Your body releases stress hormones like cortisol. These hormones keep your nervous system in a heightened state of alert, and your brain starts interpreting normal sensations as threatening. So that mild disc bulge that shouldn't cause much pain, your sensitized nervous system makes it feel like a crisis. The telltale sign that this is your problem is when your pain is worse during stressful periods, you have trouble sleeping, or you wake up in pain, or you also experience headaches, jaw tension, or digestive issues, or your pain moves around or changes intensity dramatically day to day. A major clinical trial published in the Journal of American Medical Association in 2016 showed that mindfulness-based stress reduction was as effective as cognitive behavioral therapy for chronic low back pain, proving that addressing the stress component is absolutely crucial for long-term pain management. This means that the stress component is equally important to any kind of physical treatment. Techniques like diaphragmatic breathing, meditation, or even just regular walking can help calm that nervous system down. When we combine stress management with physical treatment, I see dramatically better outcomes. And look, I know we could all reduce our stress levels. Everybody could do that. But understanding that your nervous system is amplified helps you make sense of why the pain feels so intense at times. It shouldn't be confusing anymore. The next reason is your sleep. Because here's the problem. Most people sleep in positions that put massive strain on their lower back. The worst position is sleeping on your stomach. Why? Well, this forces your lower back into excessive extension for hours. It's like doing a back bend all night long. Your neck is also rotated to one side, creating a chain reaction of tension all the way down your spine. This position compresses the facet joints. Similarly, doctors usually don't recommend prolonged back bending exercises for people with back pain caused by these joints. The second worst position is sleeping on your back with your legs straight. This flattens your natural lumbar curve and can strain the muscles. The telltale sign? You wake up with back pain that improves throughout the day. Your pain is worst in the morning, especially the first 30 minutes. You feel like you need to stretch out when you wake up. The solution? Try side sleeping with a pillow between your knees. Or if you're determined to sleep on your back, put a pillow under your knees to maintain your natural curve. This is a toughie, changing your sleep position. But it's an easy, cheap fix that you can try on your own at home. This one change could eliminate morning pain for a lot of you. If you're a stomach sleeper and you're determined to continue sleeping on your stomach because that's the only way you get quality sleep, try putting a pillow under your hips to reduce the back extension. The next reason is that you're not doing the right exercises. For the truth is, not all exercises are created equal, and doing the wrong exercises can actually make your pain worse. Here's what I see all the time. People with back pain doing crunches, sit-ups, and toe touches. These exercises put enormous compressive forces on your discs. If you have a disc issue, you're actually making it worse. Dr. Stuart McGill, one of the world's leading spine biomechanic researchers, has shown through his lab studies that traditional exercises like sit-ups and crunches can create over 3,000 newtons of compressive force on the spine. What does that mean? That's basically equivalent to having a 300-pound weight pressing down on your discs. The other mistake is just going to therapy and undergoing generic core strengthening exercises that don't target the right muscles. Your core isn't just your larger abdominal muscles. It's a complex system including your deep stabilizers. The transverse abdominis and multifidus muscles are the ones that actually protect and stabilize your spine. But most exercises don't target these effectively. Research by Hodges and Richardson, published in Spine Journal in 1996, showed that people with low back pain have delayed activation of their deep core muscles, specifically the transversus abdominis. This foundational study changed how we approach core training for back pain. The telltale signs that this is your problem is that you've been doing exercises consistently but seeing absolutely no improvement. Your pain actually gets worse after your back workout. You feel unstable or like your back might give out. The solution is to focus on exercises that train spinal stability without excessive loading. Exercises like the dead bug, bird dog, and pelvic tilts are the ones I'm talking about. I actually have a video on 4 evidence-based low back exercises. I'll link it in the description below. The key is quality over quantity. 5 minutes of the right exercises beats 30 minutes of the wrong ones. And if you've been doing physical therapy with no results, it might be time to ask for a different approach. You deserve exercises tailored to your specific condition, not a generic protocol. Reason number 5. What you eat can directly impact your pain through systemic inflammation. Here's how it works. Certain foods trigger inflammatory responses in your body. This inflammation doesn't just stay in your gut. It actually circulates through your bloodstream. And when you have an existing back issue, whether it's a disc problem, arthritis, or nerve irritation, that inflammation makes everything worse. This connection between diet and inflammation is well established in medical literature. Foods high in processed sugars, trans fats, and omega-6 fatty acids can trigger the release of these inflammatory molecules, or chemical messengers, that basically increase inflammation throughout your body, including around irritated nerves and joints. Now, the biggest culprits include seed oils and trans fats, high sugar foods that spike your blood glucose. For some people, gluten or dairy, though this really varies per person, excessive alcohol. The telltale sign that this is your problem is that your pain flares up after certain meals or on certain days. You also experience joint pain in other areas, such as your knees or your hands, or you have digestive issues or feel bloated frequently. Your pain is worse in the morning and improves as the day goes on. The solution? Try an anti-inflammatory diet for 2 to 3 weeks. Focus on whole foods, vegetables, lean proteins, healthy fats like olive oil and fish. Cut out processed foods, excess sugar, like greater than 5 grams of added sugars per serving, and reduce your alcohol levels. Track your pain levels daily. In my practice, I've seen patients experience significant pain reduction when they eliminate inflammatory foods and focus on anti-inflammatory options like omega-3 rich fish, leafy greens, and foods high in antioxidants. While diet alone won't cure structural problems, it can dramatically reduce the inflammatory component of pain. I'm not saying diet will cure your back pain, but if inflammation is amplifying your symptoms, cleaning up your diet can turn down that volume. And when we combine dietary changes with the appropriate treatment, the results can be dramatic. Here's a simple test to figure out which of these is your problem. Try to touch your toes. If you feel tightness in the back of your legs and your back hurts, consider having your hips checked out. Rate your average daily stress level between 1 to 10. And be honest here. If it's above 6 and your pain moves locations often, consider stress reduction strategies. Is your pain worse within 30 minutes of walking? That's reason number 3, or your sleep position. Has your pain stayed the same or worsened despite months of exercises? That's reason number 4. Does your pain flare after meals or improve with fasting? That's related to diet. Most people have a combination of 2 to 3 of these factors. The key is identifying your primary drivers so you can address them specifically. Look, your low back pain shouldn't be a life sentence. If it keeps coming back, it's because we haven't yet identified the root cause. And most of the time, that root cause isn't actually your spine. If this video helped you see your pain in a new way, please hit that like button. Subscribe for more evidence-based pain education that actually empowers you. Drop a comment below. Which of these 5 reasons resonated with you most? Stick around for the next video, during which I explain the top 5 reasons your doctor can't help you with your chronic pain. I'll see you in the next video.